Your liver is responsible for over 500 vital functions that keep you alive and well. Hepatitis is the most prevalent of liver diseases, and as we learned from Dr. Hyder-Jamal of St. Jude Medical Center in Fullerton, the types of hepatitis differ in severity and outcome.
Hepatitis just means inflammation of the liver. So, it's liver inflammation. There could be many reasons for that. Viral hepatitis is just one of the many reasons. There are several viral hepatitis that are out there, but the most common ones that we refer to are sort of alphabetically put in there, A, B, C, D, E viruses, but the most common ones are hepatitis A, B, and C. Hepatitis C is a problem because it most often turns into a chronic infection as opposed to hepatitis A, which is usually an acute infection and then resolves and doesn't lead to any long-term consequences. Hepatitis C is important because it most often becomes a chronic infection, and so about 4 million Americans are at this point infected with hepatitis C, and almost 3 million of them have chronic hepatitis C. Quite often patients have no symptoms because of hepatitis C. They may come to our office because they had a life insurance blood test done and the liver test came back slightly abnormal. So asymptomatic abnormal liver test may be one presentation how people may come to us. People coming in with slightly more advanced disease and they may have fatigue as their only symptom, say, well, I'm more tired than what I've ever been and I don't know why I'm tired. And then further checkup, they may be found to have hepatitis C. In most of the people, hepatitis C does not lead to anything terrible, but a good percentage, perhaps as many as 30% of such people may end up with cirrhosis of the liver. And cirrhosis of the liver is not reversible. It's a permanent disease and it's progressive disease. And then cirrhosis has its own consequences, which may lead to death, liver failure, and significant hospitalizations. So in that respect, it's a serious disease. The other reason why it has a serious consequence for our society is that hepatitis C now is the #1 reason why people require liver transplantation in the United States. The treatment for hepatitis C, for chronic patients with hepatitis C, is a combination of an injectable medication and oral medication. The treatment is not easy to take, meaning it has certain side effects and it has to be carefully monitored during treatment. How can you prevent hepatitis C from happening is a question most people want to know. Remember, primarily it's a blood contact disease. So one of the things that have happened over the last 10, 15 years is that our blood supply has gotten safer. That is no longer an issue, a serious issue at least. People have to be careful about sharing needles, and of course IV drug use should be stopped. Tattoos, people have to be careful in terms of placement, where they get the tattoos placed, that they're safe or not. If you have a family member, you know somebody who has hepatitis C, idle contact does not cause transmission of disease, so there shouldn't be that scare out there. However, blood contact should be avoided. So overall, just good, healthy, hygienic habits are important. The special cases for people who work in the healthcare business, and again, universal precautions is important to help prevent transmission of disease.